Let's go with the guide wire. Shot. 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 All right, want to make sure the guide wire doesn't go forward or backwards. We're going to come down the guide wire to the L5S1. Shot. You could see the blackness around the tip of the dilator just in front of it. That's his facet joints at L5S1. That's from the arthritis that he has going on in those joints, which we're not treating, as I've said before. We're not treating his facet joints with this surgery. We're only treating the disc. Now, a lot of people have arthritis in the facet joints, and it's basically what we call hypertrophy of the facet joint due to stress on the joints from trauma to the joints. Shot. Shot. So we're entering the 5-1 disc. It's pretty degenerated, collapsed, but nonetheless the pain in that joint is going to be coming from that tear in the back of the disc, as it always is. And that's the annular tear that we discovered here at Deuk Spine as the cause of back and neck pain. That comes from a disc problem. So not all back and neck pain comes from a disc problem, only some of it does. Shot? Yeah, so we don't want the middle thing to go any further, that's for sure. The dilator. Shot? I think we're probably in. Shot? It looks good. Take. Let me know when he wakes up, because we need to still test. Yeah. And the reason we don't have the typical iodine is our patient reported a possible history of allergy to iodine. So we don't want to put anything with iodine in the field. All right, so we're inside the disc at 5-1. Laser. Laser. Let me wipe this lens. Take it. Laser.
Ready? Yep. Do we stop? Okay. No, it's fine.
So this is the L5S1 disc that we're inside of. You can see the end plates on the sides there at 3 o'clock and at 9 o'clock. Those are the end plates of L5 and S1. The end plates mean the surface of the bones. And what's between those bones is this cushion called the disc. And it's very rubbery and soft, and it allows people to bend and twist. So it's a joint between the bones. Man, you must have slugged them out pretty hard with the propofol.
He reports he's pretty sensitive.
Huh?
So he's very sensitive.
What is it, Luis? No, we're not going to remove it. What's that? He's sensitive?
He reports he's very sensitive to medications.
All right. Grab her. Come on. Here's the main herniation. So let's get a picture of that. Get the light on quickly. Don't have a lot of time. You get this, Diego?
Yes.
See that herniation there came out?
Yes.
All right. Normally we don't get such nice herniations, but that would be a good screen capture. Yeah, take that. So you wonder why the disc can't heal. It can't heal because of that thing right there. That thing right there basically blocks the healing. It's like trying to close a gate. I don't know why we're having laser. Why it's so cloudy. Any idea? Is the irrigation colder today than normal?
Irrigation is cool. Yeah.
Colder than normal? Let's have a grabber. Scope off. Is he awake yet? No? Are you awake?
So Cesar,
How much longer?
moving. Much longer now.
Just keep him asleep.
Keep him asleep now.
Yeah.
Okay.
It's taking too long. We're not going to sit here and wait. Put pressure.
Yes, sir. Come out there, I'll do it.
You're not putting pressure. It's down here, remember? It's not up there. All right. So our discogram shows a tear. That's good. Come south a little bit so we can see 5-1. All right. Let me know when you're in position. Can you drop the fluoro a little? You're kind of too high. Table up a smidgen, shot. Come on. Shot. All right, guide wires in. Shot. Shot. Perfect. Well, the only thing we didn't get to do was to get the patient's response for the discogram, which is fine. You can see the tear. We're right there. I'm going to pull the guide wire back a little bit. Shot. Bring it back a little more. Shot. That's good.
You want me to keep doing it? Not right now?
Yeah, not right now, not when I'm going in. Shot. 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 Hold on. Shot. Shot. All right, good. Patient doing good?
Yep. Wow.
Stable?
Very.
All right. Shot. So I want to make sure we don't bring the dilator in too far. Sometimes it gets trapped at the tip with the tube. Shot. That looks good. Shot. Yeah, like that right there. Some tissue might get in there. You have to be careful. Shot. Is that the tube then? Shot. Perfect.
Continue now. Ready to answer, please? And yep. And light bulb, please. Yep.
So now we're at 4-5. We're inside the disc.
Thank you.
We've already done L5S1. And now we're dealing with the L45 herniation. Unfortunately, we didn't get to record a pain response. Our patient just took a little too long to wake up, and I actually put him to sleep probably sooner than I should have, so that's fine. We were planning to do this disc. Laser. Wipe. I take it you have no questions there, Diego?
Yes. So, will the patient need physical therapy after?
Yeah. So remember what I told you. You have to ask the question when it's written. Okay? Did you do that?
Yes.
So it's just type right now?
No.
Why are you not doing that then? Is there something else going on over there that you getting distracted or what?
No.
Huh?
No.
So why do we not ask? Remember we
There-
talked about it?
No. There wasn't a question asked.
Okay. So will the patient need physical therapy? Yes, they will. Every patient that has any surgery on their spine needs therapy. Physical therapy is a very important part of healing properly, and it has to be done properly or the therapist can actually cause an injury to the patient. Why the hell am I having so much artifact here, Luis?
Like the cloudiness?
Huh?
The cloudiness, you mean?
Not the cloudiness. It's not the cloudiness. Laser off. It's the lens. I hope we don't have another lens that's out of alignment.
If it's this one, this is actually the one that I sent. If it's wrong, I send it back. I'm testing it. So I have another one. If you want, I have right now another one.
It just doesn't look right to me.
I send it back. No worries.
You need to be testing these when you get them.
I check and I stamp out when I did the white balance. Looks fine.
No. That's not what I mean. When you have them dry, you hook them up to the camera and you test them.
Yes, we did. It looks fine.
It looked fine. So when you got this back, you tested it and it looked fine.
But I don't have fluids, I don't have tea, I don't have all that shit, you know? So that's why.
Well, you should. I mean, we don't want to be testing it during surgery,
Yeah,
right?
yeah, that's true.
Motherfucker. Fucking hell, Luis. It's dripping on my fucking foot. Come on.
Oh, please.
Figure out why. Is it my hand, my wrist dripping? Is it here dripping? Get the blue towel. Grab her.
Crystal, can you please bring a towel, please? No, not a towel. Just for the floor. Thank you.
I don't care about the floor. I care about the water going on my foot.
Alright. It's hollow for his.
The floor is not putting the water on my foot.
Right.
The water is dripping. So this is that painful area of the disc right here. This is the annular tear we're debriding. And you can see all the red inflammation in that tear. It's actually a really good one. This is a good area to capture and go over. What do you want on the laser? This just doesn't seem to be doing its job very well. It's just... Diego, you don't have any questions from the audience?
No.
Where are you looking?
On all the platforms.
You can see all of them?
Yes, and the email.
Huh?
Yes, and the email. We have a question.
Go ahead.
How long is the recovery from the procedure
1 hour.
in
The
general?
recovery is 1 hour. This patient will be discharged from the surgery center in 1 hour. Usually it's less than an hour. Our average is 54 minutes recovery, 54 minutes, so it's just shy of an hour. But everybody's different. It depends on their response to the anesthesia, as well as how heavy-handed, the anesthesiologist is, or when I tell them, it's basically however long the medication takes to wear off and for the patient to wake up. But generally an hour is on average. We're just about done here. Those are fibers of the posterior longitudinal ligament. So this looks good. I'm happy with the results. Let me know when he wakes up, okay?
You done?
We're done.
Alright, right down please.
All the Deuk Laser Disc Repairs are a 1 hour recovery.
Thank you very much. Did you document, Jordan? You remember
Let's
the
take a look at the incision.
All right, good.
You see this here? We did both disc surgery through that little incision there. So EBL was 5 mil. I've got a Ray Tech of yours off the field. Huh? It's up to you. I think one. Let's do one. Underneath, right, Luis? This is a right L45 5S1. Everyone agree? All right, thanks everyone, good job. I'll come answer questions. If you have them, type them up.
Gotcha.
The pain level got to about an 8, a 9.
The right side of my body from the waist down was pretty much useless and in pain constantly.
The pain was chronic.
It was an aching, stabbing.
It became unbearable. It became where I didn't want to get out of bed. I didn't want to talk to anybody. I didn't want to do anything.
I had the pain every single day in my low back.
It's torturous. I can't go to sleep at night. I can't lay down. I can't sit for too long. Can't stand for too long.
I couldn't sit. I couldn't stand. I couldn't walk more than 50 feet.
It's excruciating.
Sends excruciating pain across my back, gets down to my hands where my hands are numb.
I had no life.
If you are suffering from neck or back pain, the Deuk Spine Institute can give you the relief you need to live your life without pain.
Now I have absolutely no pain.
Not even 24 hours after the surgery was complete, I was able to be how I felt is normal. And it was good.
No scars, didn't hurt at all. As you know, when I woke up, it was totally painless.
The next morning, I was up and about and out, dressed on the job.
I have no pain. I'm living my life and doing great things, and I'm just very happy.
It's a great feeling not to be in pain.
Deuk Spine Institute has changed thousands of lives. Isn't it time you live your life pain-free? Log in to DeukSpine.com or call 1-800-FIX-MY-BACK for a free MRI review and consultation.
I feel like a new man again.
And it's thanks to Dr. Deuk. He gave me my life back.
Dr. Deuk did an amazing job fixing my back. I recommend him highly to anybody who has any kind of back issues, any kind of back pain. Don't wait. Go see him. The relief is amazing.
The pain level got to about an 8, a 9.
The right side of my body from the waist down was pretty much useless and in pain constantly.
The pain was chronic.
It was an aching, stabbing.
It became unbearable. It became where I didn't want to get out of bed. I didn't want to talk to anybody. I didn't want to do anything.
I had the pain every single day in my low back.
It's torturous. I can't go to sleep at night. I can't lay down. I can't sit for too long. Can't stand for too long.
I couldn't sit. I couldn't stand. I couldn't walk more than 50 feet.
It's excruciating.
Sends excruciating pain across my back, gets down to my hands where my hands are numb.
I had no life.
If you are suffering from neck or back pain, the Deuk Spine Institute can give you the relief you need to live your life without pain.
Now I have absolutely no pain.
not even 24 hours after the surgery was complete, I was able to be how I felt is normal. And it was good.
No scars, didn't hurt at all. You know, when I woke up, it was totally painless.
The next morning, I was up and about and out, dressed on the job.
I have no pain. I'm living my life and doing great things, and I'm just very happy.
It's a great feeling not to be in pain.
Deuk Spine Institute has changed thousands of lives. Isn't it time you live your life pain-free? Log in to DeukSpine.com or call 1-800-FIX-MY-BACK for a free MRI review and consultation.
I feel like a new man again.
And it's thanks to Dr. Deuk. He gave me my life back.
Dr. Deuk did an amazing job fixing my back. I recommend him highly to anybody who has any kind of back issues, any kind of back.
Hello? You're on.
Okay, Dr. Deuk Mason, and we just wrapped up a Deuk Laser Disc Repair on a patient from Texas who suffered with back pain, I think, for about 30 years. And he found us, and his suffering will end today. We will cure his back pain, that's what I expect. And we tested one of the 2 discs in the operating room, and then we put him to sleep. So I didn't get an opportunity to test the second one. We tried waking him up, but he was so sensitive to the medication, he just slept, you know, through everything. So we just went ahead and fixed both discs as planned. The second disc was definitely going to be a source of pain. The first one we tested was a 10 out of 10. And basically, I think he's going to do fantastic. So everything went well. Do we have any questions?
Yes. How long until normal activities can resume?
How long until normal activities can resume? So it's a 1-hour recovery for the surgery, and the patients are wide awake, ready to go home. We just don't want them driving themselves on the same day, but they can drive tomorrow, the next day. You can go back to work the next day. You can go back to walking and right away the next day, same day. Pretty much normal activities. However, there is a restriction on lifting. It's 25-pound lifting restriction for 6 weeks, and then it goes to a 40-pound lifting restriction for 1 year. So I recommend people just don't lift anything heavy for a year while that disc mends and heals. Remember, the disc has been trying to heal, and that's what all that scar tissue in there is from, is the inflammation trying to heal, unable to heal because the herniation is in there, keeping the annulus from healing. And that herniation of nuclear material, it's called nucleus pulposus, that stuff is just so inflammatory and irritating. It irritates the heck out of the annulus, doesn't let the annulus heal, keeps it inflamed until surgery is done, where I go in there and remove the herniation and I clean up the annular tear so it can heal properly. So that healing takes a full year because the disc doesn't have much blood flow, so it takes a long time to heal. All right, hope you enjoyed surgery, and we'll be back again next week.